This is Dr. Traster, and I'm here at the Concussion Summit with Dr. Joseph Coppus from the Neurologic Wellness Institute. Today we're going to speak about hyperbaric oxygen therapy and its relationship to concussion and traumatic brain injury. Thank you so much for being here, Dr. Coppus.
Pleasure. Thank you for having me. I'm really excited to talk about this topic.
So why don't we get right into it? And what is hyperbaric oxygen therapy? And why should I think about using this or consider this as a therapy if I'm dealing with a concussion, traumatic brain injury, or post-concussive syndrome?
Great question. Hyperbaric oxygen basically means hyperbaric means high pressure, and then the OT is oxygen therapy. So basically it's high pressure oxygen therapy. So I want to talk a little bit about how hyperbaric then works. So we know it's high pressure oxygen therapy, but why is that important for concussions, right? So we're going to take it back to a couple chemistry lessons really quick. So the first law that we need to know about with hyperbaric oxygen is Boyles Law. So Boyle's Law basically says that at a fixed temperature, the volume of gas is inversely proportional to pressure exerted by the gas. So basically means that as we increase pressure in the chamber, the concentration of oxygen is going to increase in the alveoli. Okay, so lower volume of gas, higher concentration of oxygen. So then our next law we need to know about is Graham's law. So gas is diffused from a higher concentration to a lower concentration. So the increased concentration that we just discussed that's in the alveoli is going to move more easily into the tissues. So we can see that on the graphic below. The third law we want to know is Henry's law, which basically states that the solubility of gas in a liquid is directly proportional to the pressure of the gas in contact with the liquid. So this means that the high pressure of the chamber helps to dissolve the oxygen into the blood more effectively. So not only is the high pressure increasing the concentration, it's causing the oxygen molecules to diffuse into the tissue better. And it's allowing the oxygen to then dissolve into the tissue more easily as well. So here's a little graphic that I have just depicting the different types of oxygen flow throughout the vasculature. So on the top left here, we see normal oxygen flow, and we see that the tissue is being saturated with oxygen from the blood vessel pretty normally, right? But here's an example of, maybe there is some restricted blood flow from a TBI, stroke, etc. So we see here the tissue is not receiving adequate oxygen because of this occlusion. So the good thing about hyperbaric then, if we look down here at the bottom left, is at least in the acute phase, what's going to happen is, again, that concentration of oxygen is going to be pushed more so into the tissue, and it's going to dissolve more readily into the tissue as well. And then after chronic use of the hyperbaric oxygen over repeated sessions, we're going to start to see something known as angiogenesis, or basically the formation of new blood vessels. And those new blood vessels are going to find their way to that tissue that may have been occluded from previously. So why is this important for TBI? So a lot of times in TBI, especially in those instances where consciousness was lost, there is a temporary loss of oxygen to the brain. So that's concerning. So we want to make sure that we are oxygenating the tissue that was damaged or may have lost oxygen. There's also something that we talk about a lot in our clinical practice is neuroplasticity. And neuroplasticity basically means the brain has the ability to adapt and change given the appropriate stimuli. So HBOT has actually been shown to induce neuroplasticity, especially in mild TBI patients who are suffering from the chronic stage of post-concussion syndrome. So HBOT is a great supplementary tool that we have implemented here at NWI to help our neuro rehab strategies that we've already been implementing, as well as the neurofeedback, like you discussed with Dr. Christie, I believe. And like I said, the higher pressure oxygen also causes angiogenesis, or the formation of new blood vessels, creating a more robust supply of oxygen nutrients to the tissues that we want to affect. And then some other things that hyperbaric oxygen can help with more use over time. It can help increase stem cell production, increase the body's natural healing process, increase mitochondrial size and density, which basically translates to more energy. It can decrease inflammation and increase oxygen capacity. So that all being said, a lot of our patients have responded very well to this therapy. Some of the things that they notice are reduction in brain fog, better cardiovascular health and endurance, mental clarity, some memory improvements as well, and just overall improvement in their symptomatology that they're coming in with, in conjunction with our neuro rehab strategies.
So let me ask you this: after all of that, if I'm a patient, I'm looking or I'm interested in using hyperbaric as a therapy, how would I go about doing it? How many sessions do you think would be beneficial to induce, like you talked about, that chronic use to create those new blood vessels? What am I, what kind of time period am I looking at?
Mm-hmm. Well, every patient is going to be a little different, but what we have found from the research is that typically 30 to 40 sessions is going to be our most ideal number of sessions to gain that permanence that we can gain from the hyperbaric. So getting that angiogenesis, really helping to supplement that neuroplasticity. Some people do report benefits immediately, maybe feeling a little more clear-headed, but it's not always a permanent thing until they're able to achieve that 30 to 40 sessions.
And how long does a session usually last?
So we recommend that our patients get at least 3 hours of hyperbaric a week, so that it would be uninterrupted. So 3 hours, 30 to 40 sessions without missing a week, so that we don't lose ground. But, I tell people that can be done 3 sessions of 60 minutes or 2 sessions of 90 minutes to gain that 3 hours of recommended hyperbaric time.
Perfect. And anything you want to finish up with?
No, I'm very excited that we've been able to implement hyperbaric oxygen into our therapy toolkit. It's been a great supplement to a lot of the other great things that we've been doing here at NWI already. It's a great supplement to a lot of the things that your other guests are going to be talking about this week. It's not going to be for everyone. There are definitely contraindications that we want to look at before we put anyone in the hyperbaric oxygen. But it's a very effective tool that we've really enjoyed having.
Well, thank you. And I think what's really exciting is the idea that you talk about angiogenesis and the idea that you can actually create new blood vessels to be able to pump blood in different areas of tissue that might have been affected after an injury or after some type of problem. And so thank you, Dr. Coppus, today, and I appreciate everything, and I'll speak to you soon.
All right, my pleasure.